talk. Thanks, Kathy.
Mhm.
And walk through some business items. And everybody should have gotten an email from Kathy today. And if you did not, please put your name in the chat. So I think I met everybody. And for those who don't know, I'm Heidi Orstad. I live in Burnsville and I've been serving as the president of MNORN I'm at the end of my 4th year. And I'm calling the meeting to order. And so as I said, Kathy did go ahead and send out the annual report. And in that document, you'll find my report, the treasurer's report, and the teller's report, which outlines the results of the MNORN election. Um, and then, so please refer to that document. If you have any questions, please let us know. We won't go over those in this meeting per se. And then I also wanted to introduce the board of directors, some of whom are on the call. So if you're on the call, if you'll um, turn on your camera and wave so they know who you are. So the first vice president is Cami Peterson DeVries, second vice president Colleen Quesnell, secretary Celeste Knopf, treasurer Nikki Jerry, directors Nicole, who had to sign off just a little bit ago to go to um, Alex Bates, Misty Wilkie, and Sarah Stevens. And I just want to really thank the board for all of their work this year and their contribution to MNORN. Colleen, Celeste, Alex, and Misty are terming off of their roles, as am I, in January. And we are really grateful to them for all of their service. And then I will go ahead and announce the results of the MNORN election. The following people have been elected. So Cami Peterson DeVries is going to serve as our president. Christy Walls is going to serve as our second vice president. Linda Zaret, am I saying that right?
I think
Okay, is our secretary, and the directors are Sarah Simons, Melissa Greaves, and the nominating committee is Alexandra Bates, Rachel Schickling, and Berg Ellenberger. And so thanks to all of the candidates, thanks to those who ran, congratulations to those who won. And besides the individuals elected, in the teller's report, you will see the results of the polling questions that were submitted within that ballot. So you can see what some of the thoughts are and leading ideas for some of the discussions in our membership assembly this summer. And then the board would also like to thank you for your thoughtful responses to this question because this this input really does trigger us to figure out what's important to us as an organization, our state's nurses, and then we're better able to represent you at our membership assembly in the spring, I should say. So I did submit my president's report, so please let me know if there's any questions. Nikki submitted her treasurer's report. Let me know if there's any questions. If you could put any questions in the chat, and Kathy, let me know because I can't see the chat while I'm kind of going through this.
all right.
Any questions pop up there?
I don't see any.
Okay, then we will conclude this portion of the meeting and begin the program. Okay, let's see here. All right, and so you're going to see me again. All right, here we go. Kathy attended. Kathy, you want to give the history of kind of what triggered this conversation about?
So I went to the American Academy of Nursing policy conference in November, and the Surgeon General, Vivek Murthy, did the opening keynote. And he was so impressive, and his topic was so impressive. And he was talking about the loneliness epidemic. And, this was right before the election. And it kind of helped me figure out that, we've got some problems with loneliness that are impacting how all of us are feeling about everything. And so I was really taken with it. I came home and I asked my church to bring him in as a speaker, and because they bring in speakers several times a year, and then Heidi said she had done some presentations about this, and I'm like, You're on. So thankfully, she agreed.
Yeah, thanks everybody. I just turned off my camera because I got a little bit of a message about my Wi-Fi connectivity. So fingers crossed that that will solve it. But yes, to Kathy's point, I have spoken about a lot of the Surgeon General's great work as it relates to mental health, workplace well-being, loneliness, adolescent mental health, parental mental health. So if you haven't explored these priorities that he set forth, I highly recommend you take the time to do so. I'm going to send these slides to Kathy after I share them, and all of the links will be there for you to dig in a little bit more. So starting with the loneliness epidemic. Um, let's see here. So one thing I just want to kick us off with is there was some research done in the 40s. It's been 100 years 78 years study, I should say, and they really looked at 724 men beginning at that time, kind of in World War II. And this is my grandpa. He wasn't part of the study, but this kind of gives you a sense for the population that was studied. And this study has gone on, like I said, for 70 years. They keep interviewing the members. They look at their health. They look at their family health. And it really is one of the longest studies of adult life ever done. And this population had varied backgrounds, rich, poor. One of them was a president, blue collar. And so what they're trying to figure out is what are the factors that keep people healthy longer? And again, they surveyed them every 2 years. And they really were looking for any different factor that could contribute to health. They also did in medical exams, blood tests, and brain scans. And with this front row seat, researchers were able to figure out what life choices might have contributed to people who had healthier outcomes in the end. And what was really interesting is the only one constant was that a happy childhood, that relationships matter. A happy childhood has very, very long-lasting effects, but people with difficult childhoods can make up for them in midlife. Learning how to cope well with stress has a lifelong payoff. Time with others protects us from the bruises of life's up and downs. So it was really interesting that everything, money wasn't the factor, where you live wasn't the factor. It really had to do with the quality of your relationships and attachments. So I think that just sets us up well to understand why when some of those social connections are missing, our health suffers. So this is Vivek Murphy. He's our U.S. Surgeon General. And he said, just as we need food and water, we need social connection to be healthy. And that research shows that connection can lead to better health and well-being. And what it protects us from heart disease, stroke, dementia, and depression. And what's interesting is he has about 11 different priorities right now. And when I was going through the list, and I have read several of them, the need for social connection runs through almost all of them. So I'm just going to introduce you to his priorities. So the first one here is recipes for connection. So this gets back to the need to kind of combat loneliness, parental mental health and well-being. So I put a star here if they had themes of the value of social connection, firearm violence, social media and its impact on young people, social connection, this is really the one that we're going to focus on today. Youth mental health. They talk a lot about kids being isolated. And workplace well-being also has quite a bit of that. And I would suggest that probably these two do as well, because if you're isolated, you're more prone to having a narrow view of the news that's out there. So today we're going to look at this particular white paper, Our Epidemic of Loneliness and Isolation. And I put here again kind of this access to his publications. And what I want to just identify is that being alone doesn't mean you're necessarily lonely. So what we found out is that loneliness is a negative emotional reaction to a discrepancy between the relationships we have and those we want. So again, if you're somebody who prefers to be out and you're not missing a relationship, um, you might be alone, but you're not lonely. And 62% of adults report feeling lonely. 40% of children report feelings of being lonely. And a lot of what Dr. Murphy was talking about was its correlation between loneliness and health risks. So things like cardiovascular disease, metabolic disease, dementia, depression, and put that all together. And those compounded risks promote early death as well by 29%. They say more than tobacco use and alcoholism. And when you're looking at all of what's been written, it's interesting to see this sharp increase in loneliness upon social media hitting our world. So here's just some of the articles that have been published. Is your phone making you lonely? Associations with smart use and personality. Teens around the world are lonelier than a decade ago, and it might have to do with their phones. um, and loneliness in the social media. So, I mean, there are dozens and dozens of articles about this thing called technoference, so interference by technology. And if you look at sometimes the parents, young parents of new babies, they're doing research as well about attachment, because if you're not looking at your child and responding to your child and you're looking at your phone, they're concerned about the long-term effects of those attachments and verbal skills of the youth. So I'm just going to pause here and just open it up. We've got a small group. If anybody wants to share anything that you've seen where social media is contributing to loneliness, of somebody you know or patients that you work with.
Hi, Heidi. Yeah, I'll share. I've got a kiddo and she's 14 years old. And one thing I've noticed is while she is constantly in contact with her friends, virtually, that it seems like there's less in-person interaction. That's something that I've noticed with some other people as well. It's like you feel like you're connected to everyone, you're talking all the time. So there's it seems like less of a drive to be in person and interact in that way. Which in my experience at least, I feel I'm more likely to be lonely without that in-person human interaction face to face.
Yeah, great example. She's not alone. What I'm hearing is kids are spending more hours on their social media or screens than they are sleeping. So they need 9 hours of sleep, 8 to 9 hours of sleep, and they're on their devices more than that. If you think about it, that's quite a change from when at least I was being raised. That wasn't an option. So yeah, great example.
We
Anyone
have a
else?
15-year-old in our life that he never has friends over because he says we'd all just be looking at our devices if we were together. Why can't we just do it from wherever we are?
Wow, interesting.
Mm.
And which country is it that is banning social media before 16? Was that New Zealand or Australia? One of the southern hemisphere countries came out with that, I think, in the last couple of weeks.
I think it'll be interesting to see how that impacts elders in the future, right?
Yeah.
Because say those kids are 50, 60 years from now and their social connections are different. What is our what we in long-term care we always talk, and in assisted livings or any of that, you talk about it being a social model. And
Yeah.
and what is that social model going to look like in the future with all of this going on now and how different it is? Because our elders are definitely hit that loneliness, especially those that are at home, maybe have high health needs, see maybe somebody once a week or all that, and all those other hours they're alone.
Yeah. That's a quiet house.
Yeah.
And good segue, Cami. my next slide talks just about just that. So aging adults is one of the largest high-risk populations for this, for the reasons just Cammie just listed. By 75, 50% of us will be living alone. And to Cammie's point, many goes 5 to 7 days without seeing another person. It might just be that church outing, or the trip to the grocery store. Often limited mobility, loss of friends, daily activities. Um, and some of the compounding factors are things like adjusting to retirement. Do I matter? Why do I get out of bed in the morning? There's been a lot of research on people who make it to a century. And the thing that tends to run through this population of survivors has to do with agency and having kind of a purpose in life. And if you don't feel that you have that purpose in life, you are more lonely, and more apt to suffer from anxiety or depression. The other thing is loss of companionship. Maybe it's somebody in your family, maybe it's your friends, issues with your health, lack of transportation. And so what the research is showing is that group-based social activities, where people are, to Berg's point, where they're physically together, that seems to be a protective factor for people who are aging, against kind of suffering from loneliness.
I would say the other thing that probably gets into this compounding factors is that older adults taking care of their partners, because
Yes,
it becomes
caregivers.
so
Yeah.
isolating, because it's just the two of them, and yet they've had the loss of losing that companion for what they knew, and really that really enhances that really compounds loneliness because they're very
Great
isolated.
example. Great example. The other at-risk population we've kind of talked a little bit about already is the youth. The population self-reporting loneliness most often is the population that's 16 to 24. And the BBC, they have the loneliness experiment and some of the campaign to end loneliness. 40% of those in that age group said they felt lonely very often or very often. And interestingly, they feel loneliest at school and most comforted at home. So I think sometimes as parents of teens, you think, oh, they don't want to be around me. I'm their mom or dad. In fact, that is where they feel most emotionally comforted. So, and the
I
other
think
thing that yeah, go ahead.
oh, I was actually going to just bring up work, but that whole concept around remote working seems
Yeah.
like it's going to have an interesting impact on loneliness going forward.
Yes. And you set me up too, Christy. Full-time remote work, 67% rise in loneliness. And, I think remote work happened certainly before the pandemic, but it really just escalated in 2020, 2021, and 2021. We're seeing more people being called back to the office, but I think certain populations, that is their source of communication is only through a Zoom meeting, right? And so it is definitely contributing. And
Heidi,
what?
you have two hands up.
Oh, I can't see that. Okay, go ahead.
Julia and Christy.
Oh yeah, Julia, please go ahead.
Sure, yeah. I was going to comment on that age bracket of 16 to 24. One of the reasons too I have noticed they feel lonely or they are lonely is social media, is technology. If you have
Yes.
teenagers in your home, I use my kids as an example. In my culture, I can be screaming from in the living room here where I'm, sitting, thinking they will hear me from the basement. And the next thing you will hear, Mommy, use your phone. So they're telling me instead of calling them to text them and say whatever I need, right? And you coming back from work, everybody in their room. The house is as quiet as you have 4 or 5 people, but every single person is in their room. Unless you go and knock or you call them, they can stay in their room until when they're going out of the house. I'm like,
true.
are we quarreling in this house? Why can't we interact? Can we come down and interact as family? I'm fine. I'm fine. I'm fine.
Yeah.
Everybody is fine. they are not alone, but they are lonely. They don't see it like they are lonely. So, yeah.
That you're spot on. Yeah, we were one of the mean parents that wouldn't let our kids have a TV in their room for that
Mhm.
very reason. But that I would lucked out, and our kids were out the door in college before smartphones were even a possibility. So, um, I can, and they said too that they feel really grateful that they didn't have a smartphone when they were a kid.
No.
Yeah.
Christy has her hand up
Oh yeah.
also.
Yeah, I was just, thinking a couple of things. One is that I'm wondering about socialization skills and such,
Yeah.
particularly with young people growing up without that sort of automatic socialization that you're just kind of thrown into previously. And then also, are we losing some of those socialization skills for those of us who are doing a lot of remote work and stuff like that? And then just as an example that I was thinking of, I met someone recently who uh, her job is to help the younger workforce basically learn how to socialize, how to interact with other people. And
Wow.
to this point, I had not actually met anyone that does that type of training, just literally kind of teaching people skills and how to interact without a technology face. So, so I just thought that that was kind of interesting.
Yeah, I hadn't heard of that. I
Yeah.
have a little later in the deck some innovation work that's been very successful and well studied. That gets a little bit to just what you talked about, like how do we teach kids how to um, be in relationship with others of different generations, of the same generation, without, that phone between it.
Yeah. And
So
even ourselves,
yeah,
right?
fair,
Yeah.
fair, yeah.
Thank
It's
you.
true. I also often have my work mullet going on where I have like a blazer on the top and my sweatpants and on the bottom. So,
Jessica wrote in the chat, absolutely. I just started working with a new grad nurse who is homeschooled. Small talk is a skill that the younger generation frequently struggles with.
yes, truth.
Oh, and Mary Absalon has her hand up.
Yeah, please go ahead, Mary.
Hi, I wanted to just share a couple of things that are going on in it'd be like the Bloomington, Richfield, and Edina area related to this topic. So for several years, I've been on the and chair of our Community Health Commission for the city of Edina. And the city of Edina, uniquely with the city of Minneapolis, Bloomington, and Richfield, has its own public health like city agency as a separate entity where they actually have their ability to enact ordinances. So they have a community health structure and they contract with the city of Bloomington. And some of you might have heard over the years about, and it's really pretty well established, the strength of the nursing within the Bloomington Public Health
Yeah,
Department. And
yep,
this is part of what this is about. And so several years ago, and it's about 3 years ago now, when I first was appointed by the mayor to serve in this capacity, one of the priorities that the city council had established was mental health. And it was a very broad topic, and it was keying off of people being isolated because of COVID. And so it was a really broad topic. Nobody really knew. It's like it wasn't gaining any traction. Like, what can we really do about this as a city? Because we know about this, but we're trying to what
yeah,
are some actions we can take? So what we ended up doing is to, number one, we went right into the Surgeon General's report that you referred to,
yeah,
which has
great.
established it as a priority. So that was very helpful to kind of place a context. And then the second thing is that we have, when we established it as a priority, one of the things that we did last year, which was very successful, is that the city of Bloomington, along with our other cities, had contracted with a group called Marnita's Table. And it was talking about bridging the gaps across different, I'll just say just different generational groups. And we hosted a community meeting within our city to do this. And it was very successful. And so our city really liked that. Now that we want to do more of that. And then the other piece of information that we learned is that within this kind of suburban area, that the city of Edina has more people, more older people that are actually living in their homes than most of the others than cities. And I don't have the numbers. I was trying to get that. So that was pretty interesting. But the question was, how do we kind of reach out to those people? So we're continuing to do that. Now the city council has said to us, hey, we really want you to focus in on the children, because the children are who are, it's a very children-centric community. And there have been some pretty scary statistics regarding opioid use across these couple of these jurisdictions. And so it kind of interconnects with that. So now we know that schools offer services. Oh yes, we have nursing services, or we have mental health. But
Right.
what the question really was, that was fine. Question was, what are the cities doing? And that's a very different question, because
Yep.
school districts are very separate from city structures. So we are reaching out to our bordering jurisdictions. And so St. Louis Park, for example, actually on Friday evening of this week, they're having a candle lighting kind of a gathering of mental health for children. And so they are having it. And so far, that is the only kind of community-wide activity related to mental health in kids. And we're still in the process right now of just surveying the other jurisdictions in our area, 5 or 6 cities, to see what are they even doing separate from the schools. So we're kind of trying to struggle with this and to find out ways that we can actually reach out. So I'm really listening tonight, because we know about it, people talk about it, but how do you take it to the next step? And that's it's a little bit different, a little bit trickier. So.
And I'm so glad you gave that example, because it's a real world example. I have 3 different community models that I think you could lean into that do just that, where the responsibility for socializing children doesn't lie within the schools, but it is a community. It's either a state or a nationwide effort that has been introduced with really good outcomes and data you can use, suggestions you can use. So I'll share that as we go. So kind of getting back to the remote workforce and the consequences of the remote work. And this is kind of what they're estimating that loneliness costs employers. And it really has to do with productivity due to absenteeism, because I'm going to go ahead of this for the interest of time. If you are lonely, so if you sit in this group of people, you are apt to miss 5.7 more days of work than somebody who doesn't identify as lonely. Your likelihood to quit your job, it's twice as high as somebody who doesn't identify with lonely. So if you aren't connected at work, this is what we're seeing. And, I think some of the research has also demonstrated that where there are companies without psychological safety, where you don't identify a work buddy or buddies, you're much more likely to fall into this category, whether you show up at a workplace or you're working remotely. And, these are some of the workplace effects. So diminished productivity, you're withdrawing from your team, higher absenteeism, and the risks are kind of paralleling what we heard from Dr. Murphy as well. And the benefits of connection really have been well established. So employees who feel belonging at work are more likely to be financially successful, high performers, more innovative, and more likely to achieve. And I do kind of see the same research outcomes in organizations where the level of psychological safety is very high. And if you haven't had a chance to read the Google study on of their employee population, the number one thing that led to successful employees and happy employees was a sense of psychological safety. And then if you have friends at work, again, I have something over my slide, sorry, you're going to see strong outcomes in terms of customer service, collaboration. And I think all of us have probably had opportunities to workplaces where either you really did have that secure network at work or you didn't. And just what's it like driving to work when you know you have a friend versus when maybe you feel alienated? It's a very different feeling. And the U.S. Surgeon General report is really chock full of good ideas for what workplaces can do. Number one, making social connection a strategic priority. Whether it's work happy hours, making sure that your new employees are brought on carefully with a mentor, or trying to set up opportunities to volunteer together, training employer leaders on how to promote connection, and then figuring out how was your onboarding? Because it seems as though the first year in a job, people will either establish those relationships or they won't, and they'll feel connected or they won't. So it's really that first year, especially that first quarter, is key to establishing that relationship practice. And then again, creating practices and workplace cultures that allow for connection. It's really tricky to do that when you have a remote workplace but it is possible. And then making sure that you have policies that protect somebody's ability to have connections outside of work so that they can attend their child's game or be in a church choir or be in a bowling league and not needing to answer emails throughout the night as well. And then consider, if possible, trying to introduce flexible work arrangements to, again, allow people to balance their social needs with their work life. So now we're going to talk a little bit about, this will be interesting for you, Mary, I think, as we go here. What combats loneliness? What is the research showing us? Kind of in all studies, youth and older adults as well, mattering is what seems to be the most protective factor. So, and it's interesting. So what is mattering? It means you feel heard, appreciated, and cared for. And it's important to have both. You feel like you are capable, important, and trusted. So you have a role. If you have both of those feelings, like you feel like people know who you are, you feel valued, and you are adding, you're contributing, that is the magic recipe for mattering. So if you think about like going to Cheers, right? Norm, you walk in, everybody knows your name. He matters. What he contributes to that dialogue matters. And I think a lot of this stems back to research. I think it was in the 70s, actually, it started about, if there's a book called The Third Space, and it talks about the importance of having social spaces separate from home and separate from work. So kind of getting back to Christy's point, if your work and your home is the same thing, of course, you have to really stretch outside of that to try to find a connection. So home, work or school, and the belonging space. And so the belonging space can look very different depending on what's important to you or your age. So it could be, like I said, going to the town bar. It could be going to bowling. It could be in a choir. You might be in a sports league. You might be in a music group. It doesn't necessarily matter what the activity is. It just means that when you walk in the door, somebody knows who you are and you feel like you belong. And during the pandemic, what some of the research was finding was that the belonging spaces were set aside. So you couldn't do any group activities and you were working from and learning or from your home. So there was very little opportunity to find social spaces. And this is what's really important for resilience. And I already talked about this slide. Sorry, I duplicated it. Get through that. I was doing last minute edits. So now we're going to go ahead and talk a little bit about some of the innovative models I've seen. I just pulled a few, but I'm going to leave you with resources where you can explore even more detail if it's of interest. Probably the biggest social, I shouldn't call it an experiment, but it really did start out to be an experiment, was Iceland. So back in the 90s, I believe, they were noticing that their teens were had a high drug utilization pattern. There was teen pregnancies, there was mental health problems, and kids were really isolating to their homes after school. Parents weren't there, so it was kind of those bewitching hours, between 3 and 6. And so what they decided to do was invest as a community in their youth. They put together gymnastics teams, skiing teams, soccer teams. They had school activities for children if they wanted to be more scholastic or musical, whatever it was. Children were not allowed to go home after school. They had to go to one of these between home and school activities. And the parents also had to sign on that they were going to commit to this and that they were going to establish curfews. And so this whole community swell happened, and the outcomes are remarkable. The kids are now, the drug rate dropped significantly, teen pregnancies dropped, academics went up, and interestingly, their athletic prowess was exceptional. So they started to win all sorts of competitions internationally because these kids have been training since they were in elementary school in whatever sport it was that they were drawn to. And this model has been spreading not only across the world, but even within the United States. There, we're seeing this model, this supporting kids between school and home, as being very effective. This is one example. So you can see where they call out the third space for youth. So Vermont has really taken it upon themselves kind of at a grassroots level to enlist coaches, to get capital to pay for things, to pay for activities for children who otherwise couldn't pay for activities, and just surround these kids so that they're successful socially. And I think it was to Christy's point, like, how do you teach kids how to socialize? It's in places like this. And they're doing a lot of good research, just studying the kids and their effectiveness at school in social activities and athletically. And the other one I just wanted to introduce is what the UK is doing. It's called the Campaign to End Loneliness. And this has been going on since I think like 2018. Have you guys heard of this one? And if you haven't, that's fine. But this is really a national movement to really address loneliness at all ends of the age range. It started actually in the elderly. They were studying patients who were being treated by a visiting nurse, and they were getting well more than expected when they had more visits. And what the nurses were reporting is, I'm not really doing anything medical when I'm visiting for this extended period of time. I'm visiting with them. And so what they found was eliminating loneliness, bringing more people into the elder's home, improved their health and well-being. And so what they put in place was a structure around that. So in that particular instance, they would transition out the nurse and bring in home visitors, and saw similar effects, again, because it was the social connection that mattered. So that expanded to this whole campaign to end loneliness. And they are doing quite a bit of work in this. I'm not going to go into all of it because that itself could take a couple of hours, but I'm attached here a video here. They have all of these different video vignettes. What do you do if you feel lonely? How do you manage your worry? Who can you turn to for support? Very easy to understand. And they're making it okay to ask for help. Another innovation that was kind of an outcome of the efforts Dr. Murphy's been putting into loneliness is this recipe for connection. So this is recently published, and it's really a guide for, I guess, teaching people how to reestablish going out to meals, inviting people over, different avenues where you might do this, what you might say to ask somebody to come over for dinner. So getting back to that coaching social skills, this is really one way that the U.S. Surgeon General has spread that message. And the other thing that he's doing, and this is again related to one of his other priorities, is really talking about the workplace well-being and making sure that there is connection and community. So that is one of the key attributes of a healthy workplace, as is work-life harmony. So you can see mattering at work. So it really, you can see where the loneliness protective factors are woven throughout this particular workplace model as well. So in conclusion, number one, I think we all agree that loneliness is definitely a public health risk equivalent to that of alcohol and tobacco overuse. We agree we need a cultural shift. To Mary's point, you can start at the schools, but it takes a culture, it takes a community to get this up and off the ground. And the other piece that I really liked about some of these success models was that they are doing great research and the data is driving their solutions. So they try something, they're doing a lot of innovative cycles. Collective responsibility. So again, we have to work interprofessionally to address this need, and then future focus. So to, Cammie's point, what are our 80-year-olds going to look like in, when they were raised with cell phones at 12, what is their social skill going to be looking like? So I think that's all I have for this, although I'm going to open it up to questions, but I do want to share with you, I did put some resources here for those who really want to take this subject a little bit even further. These are some resources that I've found particularly useful. So Coalition to End Social Isolation and Loneliness, Foundation for Social Connection, Center for Inclusion and Belonging. This is the link to this particular publication by the Surgeon General. And then the World Health Organization has a global effort in this regard as well. Another one Kathy and I learned about this at the Reform Conference, actually, and Cammie. The Wellbeings campaign is a national model, and it too is interdisciplinary. These resources are really developed by people that are living with the challenge. Teachers, medical and mental health professionals have come together to establish different resources, and these are particularly relevant for children. So I linked here the Minnesota resources and then the national resources. And what's cool about this campaign is the regions themselves really take this and run with it. So they are relevant to people who live and work in Minnesota. And Wyoming has one, New York has one. I think there's 8 other states. So. And then I think these are helpful numbers or links to have around. You just never know. So I like to share these resource lines for crisis help and then youth mental health. And that, I'm going to turn off my screen and open it up for thoughts or ideas, next steps. Mary, I'm curious to know if any of those resources were things that you'd come across.
Well, the Surgeon General's ones for sure, because we had just linked into that. I'm a little bit I'm not really seeing a lot. I mean, there have been some activities within our community. There was one that was that kind of popped up about a month or so ago, and then there's this one that's this week, specifically by the city of St. Louis Park, working on mental health and kids, and kind of coming together, even calling that out, and the ability to call out mental health as an important topic for children, I think facilitates talking about it.
Yeah, absolutely.
And that can be a very difficult thing, especially with our youth, that we, just have this, I mean, it's so horrible. Our Madison experience, for example, just the other day. So I think that there's that wanting to protect that. I think that because of some of the experience within the Jewish community, the city of St. Louis Park has had to, within the some of the temples, have had to look at security issues.
Oh.
And I think because of some of the security issues, you see that kind of spewing over into a concern for mental health in that particular way. I think if you flip it over, and then there's some different cultural groups. For example, there's a lot more like on the border of Edina and Blooming and Bridgefield, whole very different population of people there, people of color. And then within the city of Edina, you just go to the hockey rink and everybody's talking with each other. So there's a huge park system, sporting system, which is actually connection. However, the city of Edina has a lot of older people living in their homes. a lot. And so that is a question that I just have, and I don't really know. We don't know that information. We know that it exists. We know that it's taking place, but we don't know. We know some of it, but we don't know all of it. So we're just trying to get our hands around it right now. But I think those are really good resources, and that's why I'm interested in them and being able to pull them out. And then I think the well-being one with the youth would be really, I think that would be very helpful to be able to look at. And then the other part is we're looking at what can a city do, which is a little different than the schools in different perspectives. The other thing where it's connecting another area of our focus as I'm talking is that our city is also looking at a way to describe why this city is a healthy city. And this could apply to other cities too. But I mean, what is it about this particular area that makes it a healthy city? And so if you think about that, if social connectedness is a value of a city, that in and of itself, even calling that out and saying to its citizens, connecting with other people is important for your well-being, and you need to do it. And we have some ideas. Even just saying that can be it's like a bully pulpit.
Yes.
I mean, just those words, because people don't even think about that sometimes. So that's the other kind of concurrent activity that we have going on is how can we, you could say market or lay out or identify that. Why is this a healthy place to live? I mean, I can think of a lot of them, but we're actually looking at it in a deliberative process and with discussion and, debate. And then, you bring it up into the political people too, who are elected. So it kind of takes on a little different perspective, but I think it's really good. We're looking at that and having that conversation. And so
I'm going to say one thing and then I'm going to respond to Stephanie too, but thank you for those comments. If you haven't read it or listened to the audiobook, there's a great one. It's called If You Lived Here, You'd Be Home by Now. And it's about a statistical journalist who explored small town life in Minnesota after calling it out for being the worst place to live in Minnesota by stats. And he moved himself from a very crowded, expensive community to this small town not far from my daughter, and discovered that you aren't lonely in a small town because you matter. Everybody knows your name at the grocery store, at the bar, at the bowling alley, whereas you're most lonely is actually suburban communities because you don't necessarily, you drive into your driveway and you don't see anybody.
My dad goes every day when he's feeling well, and he feels well most of the time at being nearly 100 years old. He goes every day for coffee. Drives to what was the bowling alley and drives there and has coffee every day. And I keep telling him he's going to have to start paying rent.
That's fabulous. Stephanie, I really resonate with you. Do you want to share what your comment was in the chat?
Sure, I'd be happy to. I really think that it's easier to or maybe not easier to diagnose depression than loneliness. But I think if you're a busy provider seeing patients every 15 to 20 minutes, it's going to be easier to do a PHQ-9 and start prescriptions for depression than it is to figure out how to diagnose someone's issue with loneliness and to start to think about interventions that might help the loneliness. I know in one of our primary care clinics that I worked with at Mayo, we would have specific patients that would be coming in for visits on a very regular basis, and the providers aren't finding anything wrong with them. And finally, they had the nurse sit down with those patients, and it was extreme loneliness. And so they spent quite a lot of time connecting them to community resources. And lo and behold, they weren't coming into the clinic every week with somatic complaints that couldn't be tracked down.
Great example.
We used to have patients come in for the holidays, before DRGs. And you just knew who they were coming in, and they'd come in with all their luggage because they weren't going to be alone for the holidays. They were going to be with the nurses on my unit.
Oh,
Yep.
and I think when I think back to when I oversaw the case management at Methodist and the ER, you saw so many people frequently coming in. And sometimes, yes, it was seeking drugs, but oftentimes it was they needed to be with somebody for, they needed to eat, they wanted the company, they wanted to feel cared for. So yeah, you're exactly right.
So,
Anyone?
go
ahead.
ahead. Somebody else.
No, I just didn't know if anybody else.
Oh,
Your hand up.
my friend whose son doesn't want to have his friends over because they'd all be on their devices anyway. Started a different high school, Highland High School, they have to join at least 2 clubs, and which seemed like a great idea for him, but he hated it, and so he ended up changing schools where he can be at home. So it seems like if he had started that younger, instead of starting in a high school, it might have made a bigger difference, but they are trying it at a Highland High School.
My younger granddaughters go to Clinton, Graceville, Beardsley, a very small school district, just up the road from me, and also here at Ortonville at the school. They are now starting to ban the use of cell phones during the day at school, and they will have to turn them into the office. And I think that's great. I mean, it's like they don't need that cell phone on them 24/7.
Yeah.
And I was really surprised, and they're getting the backing of even the parental groups that's saying that yes, let's do that. And I think maybe the parents need that collaboration with other parents and the school district to say, we don't want our children on the devices that much.
Well, and wasn't there some legislation that came out around requiring schools to determine how they were going to handle cell phones in that? And so parents got letters, and it was going to be about how they were going to handle it. Some schools, I think, took it and they were just going to not have them on. And if they had them on them during the day, so they would call the parents, and the parents would have to come and get the phone. And so some of the schools really believe that they're going to hold parents accountable to the phones too. So, but I think that they had to make a cell phone plan, if I'm not mistaken. I of course don't have students, or kids in that level school, but I understand that was a statewide requirement to do something around cell phone planning, because it's interrupting school work.
Oh, for sure.
Yeah.
Yeah. The American Academy of Pediatrics has some good publications too for families in developing, just like what you said, our social media rules as a family. And it's just some of the context behind that. So.
And Diane, we have a care center in Browns Valley, so I know right where you're.
Oh.
Oh, okay. That's quite a unique care center in Browns Valley.
Yep.
Yeah. With that whole, wasn't it like a Main Street type thing?
Yep.
Yeah. I think that's really cool. Yeah. I've never visited there, but I've had friends who had loved ones there. And I think one of my former students still works there. So.
Oh, cool.
Yeah.
I know him.
Probably do.
I wanted to just share something about my 14-year-old nephew that I just love about him. And that is that he very often has his notifications turned off on his phone. And you know how it says that on there. And I asked him about it and he's like, I don't want to be bothered. And I just love it.
Oh, good for him.
Yeah.
My other nephews are not the same, but that's something unique about him. Is pretty cool.
And kind of adjacent to that, there's a book called The Anxious Generation. I don't know if anybody's come across that. And that author too kind of pulls together research and makes recommendations himself. But one of the things that I thought was interesting, and I heard a podcast about it, was, think about yourself as a child. When I was 10, I would take a quarter, meet my friend about 3/4 of a mile up the road, catch the bus to downtown, spend the day downtown, and come home. I had to be home by 6 for dinner. That was the only rule. I had my babysitting money in my pocket. Nobody knew where we were. And now in Georgia, somebody was arrested because their child was 3/4 of a mile from home unattended. So it's just, such a different way to grow up, and the
Right.
agency you get when you start doing some of that when you're younger, so that when you're an adult, it's not scary to get on the bus, purchase something, talk to other adults. And what opportunity do kids get to practice some of those skills alone, right?
I remember too, as a child out here in rural USA, we had clubs. I mean, I remember everybody started Brownie Scouts. There was not one girl in our school that did not participate in Brownie Scouts, and eventually Girl Scouts, and choirs at churches and things like that. We had those things, and out here in the rural area now, we don't have that as much as we used to. And so I think that can certainly lead to some of this loneliness for children, because they don't have those after school activities necessarily.
Exactly.
I believe this generation are missing the social skills.
Yeah,
They are.
you're exactly right. Your
Yeah.
example was a really strong one, and I think it's happening all over America, Julie.
Yeah.
Julia, people are in their own room on their phone.
Yes, they're missing the social skills, and some of them don't see it as something abnormal.
Yep. Well, I'm looking at my time here. We're just about up, but thanks everybody for the conversation. I think it made this an even more rich
Thank you.
topic.
Great presentation. Thank you.
You're
Thank you
welcome.
very much. Thank you.
Mhm.
Yes.
You're welcome. So I will
Thanks
send
for
this
your
to Kathy.
expertise, Heidi.
You bet. I'll send this to Kathy and she'll cascade it to you guys. And if it's helpful for you to share with others, please do spread the word. So
And Heidi, we want to just thank you as the president of the board, and that you're going off and all the work that you've done these last 4 years. And you've just been awesome to work with, and just been an awesome president. We will miss you and are glad that you will be there for consultation.
well, thank you. Thank you for your kind words. And I
Thank you
will.
so
I
much.
have your back.
Yes, thank you.
Thanks. Well, have a great holiday, everybody. And we'll see you next year.
Yeah,
Thank you.
Thank you.
Bye-bye.
Bye.
Good night, everyone.
Bye,
Good
take
night.
care.
Good night.